My full name is Virginia Faith Coutts. I'm born and bred. I'm a local. Born here. I have two older brothers. My mother belongs to the Yidinji tribe, and my mother's father belongs to the Irrakanji tribe. So we are traditional owners here of Cairns. All my family do all the welcome to country. So when we have NAIDOC and big openings in town, it's my family welcoming everyone to country here. I love working on my mother's country, my mother's father's country. So passionate, and I know when I do pass the pyramid out there, I know I'm out of my mother's country, because that's something that I'm so lucky to have, working here, born here, but still working here. 2000, I've been a health worker since then, and I'm very passionate. I love being a health worker. It was one of my personal goals growing up, and I saw a lot with my family, my immediate family. So growing up, I was lucky to be support for my mum's oldest brother, my uncle. He was always having his diabetes complications. So in the 80s, back then, like I saw he needed a lot of support. So I was like able to translate for him and then explain what the doctors wanted for him to do. And out of all the family members, I was his little shadow. So I was always with Uncle at the hospital. So I learned lots from the doctors and nurses. And that's where my passion came, is that I could, my goal was to become a health worker so that I could help my family, but everybody else's family too. And that's where been working since 2000. So I love this industry. I feel this is what I'm born to do, become a health worker. And then the senior health workers that I worked with are very confident, strong, passionate women that helped train me and then guided me to then have the confidence to do many things in the clinic, like from dressings to ear checks, screening from newborn to elderly, phlebotomy, podiatry, like routine foot care, working with the diabetes foot clinic. So those ladies were very, very instrumental in the medical industry, having senior health workers to then guide other trainee health workers in the medical places where they worked, whether it was at Queensland Health or AMS or private practice. Senior health workers are really, really good that trained me. So most of those ladies are retired now, and some have passed that I know of. So it's those stepping stones, you know, those, yeah, it's so important. Yeah. Yes, there is a study available. We know here at Cairns TAFE, they do have the courses available there. And it's always, I like to encourage any of my own family members and friends, if they're interested in going into health, this is the pathway to go to. Because with TAFE, you have the teachers there, you have your students from Cape and Torres come down for their block training as well, but everyone learns from one another. And I like that, because the ladies from Cape and Torres, they then go back home and then they're back in their clinics. So to have the training is very important. You're also lucky to find some training at the universities as well, and even with online courses as well too, yeah. The best part about my job is knowing that the knowledge that I've been trained from the health workers, I learned from the patients, the doctors and the nurses and specialists, is that sharing that information with every other patient too, so that we're all doing the right work. The patients are they're doing the good work at home, doing the self-management, and that they're capable of getting that confidence to look after their diabetes, attend their appointments for the optometrist or the dentist, cardiologist, endocrinologist. So it's passing on important knowledge to them, because they then pass it on to their family members too. And even if, when it comes to the medications, you'll have a family member reminding them, have you taken your blood pressure tablet? Have you done your sugar check yet? Have you checked your BSL before you're eating 2 hours post? So it's keeping that knowledge and passing it on to the next family members and everyone's families as well. Yeah, do it. It's amazing. It's really, you learn a lot with getting into health industry. It's so rewarding, and health has many roads. So it's just it's there at the universities to then put that good work in, because you don't know how much potential you have until you give it a go. And I love that about reach your goals, set new goals, and because you can do anything. It's just really rewarding in every way possible. So I love being a health worker, and there's many people in our community here that come up and recognize me everywhere and anywhere, and it's good that they have that trust in with you as well, building that rapport with the community, because they know that you're approachable. They can come to you, and you're always there to have a listening ear, but also give them the good advice to to look after themselves, but giving them the knowledge and confidence and support, because it's just sharing that with families. Yeah.